What's going on, everyone? My name is Ben Choi from Go Physical Therapy. Today, we'll talk about the red flags for physical therapists. Yes, we have good therapists. Yes, we have bad therapists. But yes, we also have ugly therapists. And so these are some things that you should consider when you see a therapist, when you see somebody to treat your injury or whatnot, and see if they actually are helping you or actually making it worse or not really doing much for you. All right, let's get into it. The first reason why I'll see patients coming here and Go Physical Therapy is that the other therapists don't really listen. They don't listen to where their pain is. They don't listen to how their pain is developing. And they kind of go through this cookie cutter approach to treating their patients. And so oftentimes they'll come into the clinic saying, hey, look, I've been treated with physical therapy for many, many years, but this injury does not really solve itself. It's still very painful. It's still very tender. I still can't move much. And so they'll come in and say that, and I listen to them. I listen to what they have previously, before they had this injury, what their function was after their injury, seeing whether there's any correlation between any other factors, like if they had any stresses in their life or any changes in their life, seeing how the injury actually happened, and seeing how they manifest, see how the other previous therapists or previous rehab approaches were for that patient. And then from there, I might even ask more questions on top of that if it warrants based on the information. And so I try to listen, we try to see what's going on with the patient themselves. The second thing that I see in terms of red flags for physical therapists, which relates to the first point here, is that they utilize a cookie cutter approach to rehab. Say, for instance, you have a shoulder injury. All they give you is just some external rotation 90 degrees. They might give you some overhead 90 degrees. They might do some PNF patterns. And that's the extent of the rehab program. Yes, it might work for some people, but it doesn't work for all people. It's a cookie cutter for a reason. It's not necessarily individualized for the patient. Every patient, every individual has their own goals, have their own issues, and they have their own things that they need to work on. And so to put a general blank statement for everybody to get on for rehab is not necessarily the right approach. Usually with any programs that we offer here, we try to at least listen to the patient first and try to get to very specifically what they need in terms of rehab. And so from there, we prescribe the specific exercises needed for that rehab process. The third thing that I see in a lot of patients that go through a PT is that the PT does not progress any of their exercises. They are stuck doing the same thing for 6, 8, 12 weeks, doing the basic exercises that they've always done since day one. And maybe, yes, they'll add a pound or two, but that's the only extent to it. They don't actually tell them to progress into a more global exercise. Say, for instance, a shoulder injury that may happen. They go ahead and do first external rotations. That's okay. They might need that, and then some overhead. That's okay. But then from there, they don't progress it at all. They don't give them some pressing. They don't give them some more rows. They don't give them some more dynamic stuff, maybe a full body, a dumbbell snatch, or some sort of exercise that progresses the shoulder. Every person will get stronger with the exercises that they're given. They'll adapt to the exercise. And so the goal, if a person needs to be even stronger than that, is to change it, whether that is through adding intensity, so weight, adding more reps, more volume, or changing the exercise to be more difficult, a little more fatiguing towards the body. The last and final thing that I always see, and this is actually really, really crucial in the PT rehab process, is that the physical therapist in general is not interactive with you. Whether he or she sends a rehab tech to help you rehab your process is not an actual physical therapist. Maybe the physical therapist is seeing 3, 4, 5, 6, 7 patients at a time, and they don't have any time to see you. Or there might be just typing on the computer as you're doing your whole workout program by yourself, and you know exactly what it is from head to toe. They don't actually talk to you. They don't actually really see you. They don't actually really look at your form and say, hey, look, you got to correct this. You got to correct that. Let's progress this exercise. Let's regress this exercise. It looks too difficult for you. And so for this portion, if they don't really interact with you, I suggest not even interacting with the patient, with the physical therapist at all. And even if they do all this and they do really well, but they're not really interactive, that's really a sign in which the physical therapist won't really progress you well. They won't give you a good rehab process. and they won't really listen to you. And so what I would suggest is if you go to a physical therapist, they're really interactive. They see you only for 1 hour or 30 minutes or whatnot, and they actually talk to you. They understand who you are as a person, and they want to progress and regress things. They see how you're moving. That's a good sign for a good physical therapist. All right, everybody, that is the video. If you have any questions, comments, or concerns, leave them down in the comment section below. Give us a like, share, and subscribe to our YouTube channel. More videos coming soon, just like these.